disease we really hadn't have to worry about for a decade is making a major comeback, and the media freakout is upon us. Let's look at the facts. It is true, the numbers are higher this year than we have seen in a while. 1,288 confirmed cases across 38 states, and Texas has more than 700 of those cases. That's where this started, with a Mennonite community that never got vaccines. The numbers seem scary, but now we're going to ask the questions that none of those other television networks will. With us now, Dr. Ashish Jha was a former White House COVID-19 response coordinator under President Trump and is now the dean of Brown University School of Public Health. The court has admitted you as an expert, sir. It is great to have you. Thank you. If someone is vaccinated and otherwise healthy, a la me, it is my show, should I be worried about the measles?
No, absolutely not. Look.
And what
so
about
I can say more, but the answer is no. Like, if you're vaccinated, you're fine.
If you're vaccinated and you're healthy, why aren't we hearing this? What is all this? So if you're vaccinated and healthy, which is most of America, this seems to be a lot of fear mongering, or am I seeing it wrong?
Well, so the way I'd look at it is, look, if you're vaccinated and you're healthy, you're fine. The worry that I think a bunch of us have is there are a lot of kids who can't get vaccinated, like immunocompromised kids undergoing cancer therapy. They're at serious risk. And then the first dose of the vaccine doesn't happen until 15 to 18 months. Kids before then can also get measles and again, can actually get quite sick. So this is really primarily about kids and making sure that they're protected.
And I'm going to sound stupid asking this question, but I found asking stupid questions is better than making stupid mistakes. How does someone get the measles?
It's super contagious. It may be the most contagious human virus we have. It's primarily respiratory. Let's say I have measles, I breathe it out. You could walk into this room half an hour later and pick it up by just breathing it in. So that's primarily how it is. Respiratory droplets, they hang in the air and they can infect other people.
Do you think part of, and I will use the word freak out that exists, why this is consuming so much of our media ecosphere is a way to make people upset or fearful or whatever about RFK?
Well, no, look, I don't know what's causing the media freak out. I'll tell you how I see this. In medical school, I got one lecture on measles and only one, because my professor actually told me, he said, look, you're only going to see measles if you go work in a third world country. So part of it is like, I can't believe we have measles. And what worries people like me is, what are we going to see next? Polio? I don't want to see polio back in America. So there's a little bit of like, we should not be dealing with these diseases that we've eliminated. And either way, RFK is not helping. He's not helping.
Okay.
He should be telling people to go out there and get vaccinated.
I think, to be fair, he said about measles that people should. But think about where these cases are in Texas. This is the Mennonite communities. These people are different than what we think of as the anti-vax MAHA movement, people who didn't want to take the COVID shot, right?
Yeah. Yeah, absolutely. Like, the Mennonite community has had very low vaccination rates. Not all Mennonite communities, they do actually vary. Some of them do get vaccinated. But the way I look at it is, I care about all American kids, Mennonite, right, Amish, everybody else.
We should, yeah.
Yeah, and we should try to figure out how to protect all kids. And, and again, what I would say about the health secretary is, yeah, he sort of has said it, but he should be much more forceful about saying people should get their kids vaccinated against measles, against polio, so we do not have to see a resurgence of these viruses.
Yeah, look, it's scary, especially when you make the point about if people are traveling and they've got a year-old baby. My sister's pregnant, it's going to give birth soon. You're scared about that, and where you take it is contagious, as you say. This is, when you think about where we are in public health, and you are one of the really sanguine voices all through the COVID crisis in the pandemic, how do people like yourself, who are that voice, get people to trust them again about needing to get something as simple as the measles vaccine?
Well, first of all, I think, Leland, it would begin by doing a lot more listening. I think one of the mistakes we made in the pandemic is we preached down to people. We told them what they needed to do, and we didn't really listen to their concerns. We didn't listen to people's voices. I think I try to spend a lot more time listening than talking. And secondly, it is never helpful to be preachy. It's never helpful to tell people they're dumb or they're anti-vaxxers. Focus on what people's concerns are, listen to them, and address them honestly and openly. I think if we do more of that, I think we're going to win that trust back, not overnight, but over time.
Dr. Jha, we're always better for having your thoughtful voice, be it on measles or anything else. It's good to see you, sir. Thank you.
Hey, thanks so much.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.